My name is Abraham Aguilar, and I'll be doing a presentation of my slides, Mystery Behind a Leg Pain. So basic information is the patient of this case would be Catherine Rook, which is the woman in the left of this picture. The woman in the right, Kaylee Rook, would be her spouse. So the incident would start off when Catherine was going on an evening jog in October 2021, where she'd suffer excruciating leg pain in, both her legs. She'd then be raised to her house by her co-worker, where she'd rest for the rest of the day. By next morning, the pain would completely disappear, and Catherine has had surgeries in the past in attempts to resolve this issue. Her leg pain has gone as far back as high school, and the true cause for it wouldn't be discovered until a coordinator from the Maya Clinic in December 2021. So Catherine developed her leg pain in high school, and both her and others' initial beliefs were due to shin splints or stress fractures, and her symptoms at the time would be leg swelling with bluish or purplish tinge during running and after. However, the pain would quickly subside after a short rest, and her leg would go back to normal. She wouldn't have much doctor visits since she didn't believe they were necessary, as the pain would disappear shortly after. But by 2018, she'd see a primary doctor, which would exclaim that there's 3 possibilities for the pain: shin splints, cracks in the bone, or chronic exertional compartment. Catherine would be prescribed physical therapy. However, it would make no progress, and she'd report her feet tingling and going numb when engaging in certain activities. Weeks later, she'd undergo a test for compartment pressure, which was discovered that she did have high pressure within her legs, and surgery was later performed on both of them, which seemingly solved her pain until in 2021 when the pain would resurface. Earlier that year in December, Catherine would be diagnosed with functional popliteal artery entrapment syndrome, and she'd go through an angiogram in order to test for the possibilities for it. She tests positive, and by April 2022, she'd undergo surgery on both of her legs once again. So some medical terminologies. Shin splints is an inflammation of the muscle, tendon, and bone tissue around the tibia, which usually means that you'd have pain where the muscle connects to the tibia itself. Then there's chronic exertional compartment syndrome, which is a condition where the muscles build up too much pressure, which actually decrease your blood flow through the arteries, and worst case scenario, you'd have to amputate them, your limbs. Then there's the fascia, which is a connective tissue that basically connects and supports your whole body structure. There's compartment pressure testing, which is a test that measures the amount of pressure within a muscle compartment. As you can see at the bottom right, they insert a syringe in the limb and test your pressure with that. Then the orthopedist, a doctor that focuses on injuries and diseases affecting your musculoskeletal system. Then there's vasectomy, which is a procedure which the fascia is cut to relieve pressure in the muscle compartment. Then there's functional popliteal artery entrapment syndrome, or PAES for short, which is a condition where the muscle is larger than usual, which actually squeezes the popliteal artery, which is located in the back of the knee. Then there's stenosis, narrowing of one or more spaces within an artery or spinal canal. an angiogram, which is an X-ray used to examine blood vessels. Then the top left, you see an illustration of the leg, popliteal artery. Then in the bottom middle, it's an ultrasound, which is usually done to detect any irregularities of the blood vessels, the popliteal artery specifically. Then the top right, you see an MRI scan, 2 MRI scans. The top shows the knees, which the arrows are pointing to the popliteal artery and the muscles that surround them, which is usually done to detect any abnormalities. And then below that, it's the popliteal arteries highlighted along the legs. And my theories at the time of reading the article were that the cause of the pain was possibly due to muscles being overstressed, possible damage to the bones, or perhaps an old injury that never healed correctly. This was because Catherine didn't have many doctor visits because, well, the pain would quickly disappear, so she never really went to any. And she often exercised and participated in extracurricular activities. She was very active throughout her life. And then the pain began at an early age during high school, which I ruled as possibly an injury which didn't heal properly. However, in the end, she'd be diagnosed with PAES, and this was the reason for it wasn't solved earlier was because both chronic exertional compartments and PAES show similar symptoms. There's high pressure within the muscles, and then there's some irregularities in the blood vessels, the arteries. However, the reason for the discovery of PAES was because she'd undergo additional tests which actually would discover the irregularities of her muscle structure and the popliteal artery itself. Earlier, she'd gone tests to see if there's any damage within her bone structure, which came out normal, no damage whatsoever. And these are my sources. And thank you.